The best treatment option for pancreatic cancer is surgery, and in most cases that surgery is called a Whipple's operation, which means removing half of your pancreas and part of your small bowel. Unfortunately, only about 20% of patients in general that have pancreatic cancer are suitable for operation.
When a surgeon's assessing patients to see whether a Whipple can be done, it depends on the stage of the tumour. In a stage 1 tumour, which is less than a centimetre in size, usually a Whipple can be done quite easily with good wide margins and a good outcome. A slightly larger tumour starts to grow and abut on the main vessels, and it can still be taken out at that stage, and unfortunately a lot of the tumours at the moment are that size. However, if the tumour has grown so much that it is wrapping around the blood vessels or spread to the liver, then it cannot be taken out in its entirety, and there's no point having a big operation in that circumstance.
The operation is a long one, it's approximately 5 hours. However, when I came through, I looked at the clock, it was only 2 hours instead of the 5 hours that he explained to me. So I knew in my heart that things didn't go right. When I recovered, the surgeon came out and spoke to me. He told me that he was very, very sorry he couldn't operate on me because the cancer had already spread.
So the main problem with having a pancreatic cancer that we can't remove is that the bile duct's blocked and you're jaundiced. And part of the jaundice means that you get very itchy as well. It can also affect the way everything else works. And so previously we had to bypass that blockage. Now we can do that using stents. So we can put a stent in it and open up the bile duct so that it passes through. But sometimes doing a surgical bypass, which is bypassing things how we used to in the past, is more appropriate for an individual person.
The main problem at that stage was his jaundice, so we saw a surgeon to sort of try and relieve the jaundice. He couldn't do the huge Whipple's operation that they sometimes do, so he just did bypass surgery, which solved the jaundice problem and his eating problem. So as far as I'm concerned, the surgery was a great success.
This is called a double bypass because both the stomach and the bile duct are drained around the cancer so that the symptoms of blockage are relieved.
When I went and saw my surgeon on the Monday, he explained the Whipples. He said, we can try it, because we both said to him, well, they've told us they can't do anything. The tumour's too big, you know, it's sort of gone too far, they can't do anything. And he says, you never say never. And he said, we'll go in, we'll relieve the jaundice, and while we're there, we'll just have a look. And he did explain the surgery to us.
In order to decide whether somebody's suitable for an operation for pancreatic cancer, we do a lot of investigations and tests because we don't want to go ahead with this operation lightly. We want to make sure that we're doing the right thing for you. So we'll do scans, we'll do an endoscopic ultrasound, we'll do blood tests, we'll send you to see a cardiologist or any other specialists in case you have any other issues with your health, just to get you completely ready for that operation.
When I went in for surgery, they were actually, the main reason for the surgery was to try and relieve the jaundice, to relieve the blockage. And my wonderful surgeon said, we'll see what happens when we get in there. And I don't know, 8.5 hours. I was asleep the whole time, so I don't know how long it was. But when Mark finally got to the hospital and my sister was there panicking and saying, she's still in, she's still there, she hasn't come out. And he says, oh, great, they've gone for it.
Well, I said to him, well, what will happen if I don't have the surgery? Because I was in two minds whether I wanted to go ahead with surgery. And he said, well, you've probably got about 12 months to live.
They didn't tell me what the life expectation, the general life expectation of somebody who had Whipples was. So I took the attitude that I'm going to go and have the treatment, have the surgery, do whatever's necessary, and we'll be back on our feet and back leading a normal life.
Well, I was in total naive about the whole thing. I didn't know what the Whipple's procedure was. I mean, in my naivety, I said to him, "Are you going to do it via keyhole surgery?" And, you know, I thought it was going to be sort of just a day thing, and I'd be in for a couple of days and out.
A Whipple operation is one of the most major operations you can have. Historically, it's been fairly dangerous. However, today, with our special techniques, the supports in specialist hospitals, intensive care units, and so on, the risk of the operation is dramatically reduced.
Resection of the pancreatic cancer depends on where it is. If it's in the tail of the pancreas, a smaller operation like a distal pancreatectomy is undertaken. The Whipple's procedure is used for cancers of the head of the pancreas where it's more common. The head of the pancreas, the duodenum, the bile duct, the gallbladder are taken out, and all those ends are put back together again with joining of the pancreas to the bowel, stomach to the bowel and bile duct to the bowel. So it's really quite a complicated operation.
It turned out to be more complicated than they thought because one of the veins was compromised, and a 4-hour operation turned into a 9-hour operation. I had to ring my son to get permission to do another procedure. So I went into surgery at 9 in the morning and came out at 6 at night. So spent the night in intensive care and then was taken up to the general ward the following day and thought I'd been hit by a train, really.
The actual losing those organ parts are not the most difficult thing for a patient. Mostly it's getting through the operation, and once somebody's got through the operation and recovered, and generally it takes a bit of time, it takes about 3 months, often up to 6 months to completely recover from the operation itself.
I had the surgery 3 months ago and I'd say that I'm still recovering. I'm still not up to my full strength. I still don't have enough stamina to do all the things that I did before. I'm not back at work yet, and yes, don't feel well enough to be back at work yet.
When you wake up and you've got tubes in your belly and you've got staples and you've got things up your nose and down your throat and everywhere else, I didn't sort of feel a lot, and they kept me pretty, well, doped up as well. But I was relieved. You know, it does take a little while to get over the operation. I remember the first time I went for a walk was probably about 3 weeks. I thought, I'm going for a walk down to the beach to just even look at the ocean. And it was only 200 metres. I had to ring a cab to get me home. You know, now I do the city to surf.
I tend to focus more on what happens at home after the operation and make sure they have an appreciation of what a huge operation it is and that it's complex, but once they leave the hospital, it's not over then. It'll take them months to get back to normal, and I need to know that they've got someone there at home with them, because people won't cope after an operation this big if they're alone and they have no one. And we need to go through that, or if they need to move in with family, have family move in with them. Things like that are important, that they know it doesn't stop when they leave hospital and not miraculously well again.
I was in and out of the local hospital on many occasions when the feed line fell out of my stomach, and I wasn't able to eat and I was losing weight. And I can recall once I got out of hospital for about the 3rd time in Nowra. A car club that I've been a member of for many years was having a function in Nowra, so I went along to that function, and it was the first sausage sandwich that I'd eaten in about 4 months, and it was absolutely beautiful.
Now, yeah, I'm able to do almost everything that I'd like to be able to do. I still suffer from an amount of fatigue. I still get very tired very easily, but if I manage that, I can do anything that I particularly want to do. And I just think it's so great that I'm able to go out there and do those things with my family and with my kids. It's excellent.